Once again, happy morning.
Good morning, Father.
Wish you a great day. Today, we'll be rocking with some new steps regarding reading part C. This week, almost every day, we have sessions.
Father, actually, I just want to thank you for arranging so many sessions. Thank you so much.
This is mainly because our empowering team is working for me. So I have saved so much time because of them. You allot 10 minutes to assist this platform. You can relieve me of other works of managing the platform, and I can give you sessions even every day. Now there are the two empowering group members who are helping me in every corner. So they do whatever I want the things to be done. So enroll more and more.
Thank you so much. Empowering Army, thank you so much.
Yeah. I wish that everybody becomes a part of Empowering Army. Spend at least 10 minutes per day for others, empowering others, assisting the platform, so that I dedicate full time for training. And today, reading part C is a bit advanced session. If there are beginners, don't worry. You can go into my videos, previous sessions, find out the details. I may not be explaining again the details, minor details, or the basic aspects of the various strategies. However, you'll be able to understand in general what is to be done, and we'll be looking at a particular text where we'll be doing the analysis. Our motto is to make you fall in love with OET. I am damn sure there are thousands of students being fallen in love with OET, and it has become an addiction for them. Learning as a basic become a passion, and they're enjoying and rocking. And now I have to tell them, stop studying, no need to practice so much. And a lot of people text me saying of their improvements. That's great, but if you have some issues, challenges, don't worry. Be persistent and ask your concerns in the mentors hour. And this is, even the admissions are regulated as per the mentors hour's concerns. We have asked concerns, we have admitted them on a preferential basis, and always the empowering group and the premier members have a preferential admission. So also all those people added people to the platform and empowered others have been given a preferential admission to the live sessions. So let's rock. And if you're watching on YouTube, kindly consider subscribing. Give us a thumbs up if you like the work, and share so that we empower more and more people and help them in their struggles. So also keep the bell icon pressed so that you get notifications as and when we upload new videos. Today will be slightly fast, but then because I think majority of you are not beginners, so we might go a little fast, but then definitely you can note down in a piece of paper if any slide you need to revisit. Definitely we'll come back to those slides and explain to you again. And make sure that you have a pen and paper with you. As I go on explaining, try to write down the things that will make it more clear. OET 2.0 Professional English Text Subtest Reading Part C, and Reading Part C, basic key skills we are looking into. And as I usually tell you, we are aiming at a 450 to 500 score. 450 is not a big deal. Definitely you can if you go with persistent practice with patience. All these basics, duration is 1 hour part A, 15 minutes, and part B and C, 45 minutes. And as we get into part C, two long passages are given, extracts from informative articles or papers about issues related to the healthcare field. These are MCQs, 2 passages, 16 questions, MCQs with the 4 options. 6 questions, comprehension of viewpoint, opinion, impressions, conclusions drawn, and give a definition of, or 2 questions on what we call lexical questions. Give a definition for the meaning of a word or a phrase. Explain the meaning of the word in the context. Okay. And as usual, I just run through. You should be looking into all the headings. If there are subheadings, names, person, device, body parts, abbreviations, number, percentage, scale, synonyms, synonymous language, paraphrasing, cause and effect, comparison, types, chronology or time expressions, modal verbs, and opinion words. Those are 7 Sapta Sutras, you have to use it everywhere. Synonyms, comparisons, contrast, scale, narration. Usually you have passive voice, and the last one is adjectives, use of adjectives. Okay, to select the correct answer, 7 skills we are going to look into today. So first one is read the text for gist. Okay, 7 skills to select the correct answer in reading part C. Read the text for gist means read it for the main idea, not a single word or single sentence, whatever, but look into the main idea given in the particular paragraph or text. Gist will help you to identify opinions. This particular gist will help you to identify opinions. Identify opinions by hedging words. Number 3 is identify opinions by hedging words. I'll explain to you later what are hedging words. And 4, read for emotions or subjective agreement. That also I'll be explaining to you. Look for opinions in the main clause. Okay, I have taught you about dependent clause and main clause. So usually opinions are in the main clause. Don't be misguided by the independent clause. Okay, main clause means that independent clause. Don't be misguided by dependent clause. Look for modal verbs that you already know. Focus on the structure of the paragraph. So I repeat, number 1, read the text for gist. Number 2, gist will help you to identify opinions. Number 3, identify opinions by hedging words. Number 4, read for emotions or subjective agreement. Number 5, look for opinions in the main clause. 6, look for modal verbs. 7, focus on the structure of the para. Don't worry, I'll be explaining to you all these details. And identify opinions by marker words. Marker words could be something like, in my opinion, I think, say, I believe. All these are marker words which will tell you this is an opinion. But if they use this particular expression, in my opinion, I think, say, they say, or he says, I believe, all these are marker words for opinion. Identify opinions by hedging words. Hedging words means probably, perhaps, maybe, and likely. All these are hedging words. If these words are being used in the sentence or in a text, in a particular part of the text, that says it's an opinion of the writer or some other person. And read for emotions or subjective agreement. Emotions means you'll be less putting some words with a lot of emotion, saying that it's a compelling idea that you should practice persistently with patience to get a good score in OET. So compelling means it is interesting. It's interesting. It's compelling. These are the emotional words or subjective agreement words. Remarkable. The progress of particular OET aspirants or few of the OET aspirants is remarkable and worthy of attention. Remarkable or worthy of attention. Unfortunately, sadly, some of them could not make up because they lack practice or persistent practice in their goal. Okay, those are. 5th one, look for opinions in the main clause. Or writing subtest, I explained to you structure of the complex sentence, whereby you have an independent clause and a dependent clause. Where I said you can either start with the dependent clause or independent clause. Both the ways you can structure the sentence. For example, despite the countless challenges that the OET aspirants face in the low resource environment created by various service providers, OET remains the best hope for many health professionals in building up their future. So, despite, the first part is the independent clause. OET remains the best hope for many health professionals in building up their future. This is the independent clause, okay, or the main clause we call. The dependent clause is also known as subclause, and independent clause is known as main clause. So always don't be misguided by the opinions given in the subclause or the dependent clause, but always look into the main clause. So OET remains the best hope for many health professionals in building up their future is the main clause. But whereas in the subclause or dependent clause, they have given a negative impression about the OET learning, okay, about low resource environment created by various service providers. But the fact is, what the writer wants to say is OET remains the best hope. So it's very positive. So don't be misguided by the subclause or dependent clause. Focus on the main clause. Look for modal verbs. I need not explain that. Can, could, should, must, all those things are there. Already I have explained in the previous sessions. And 7, focus on the structure of the paragraph. I already explained to you in different triangles, different models where it speaks about topic sentence, supporting sentence, developing sentence, and the linking sentence. Okay, those are already done. Now we are going into a passage today. This text is taken from OET official materials. I thank OET for allowing us to use this material. Thank you, OET. And let's launch into that so that we have a competent text today. Very interesting. And the text speaks in a sequence. Fact about ADHD. Second paragraph speaks about a controversy about the condition, about this particular condition or disease. And paragraph 3 speaks about ADHD and other conditions. 4, onset or genesis or the beginning of the condition. And paragraph 5 speaks about diagnosis and drugs, and also all drug manufacturers, drug companies, all those things. And coming to the last paragraph, we have after effects of medication. You can see a beautiful flow here. This is what you have to understand the gist or the message of the text. So the first paragraph speaks some fact about the ADHD. It is the introduction. And second paragraph speaks about a controversy regarding this disease or condition. Third paragraph speaks about ADHD and other conditions. There are confusions regarding symptoms, how to confirm whether a particular person has ADHD or some other condition or mental disorder. Fourth is onset or beginning of this particular disease or condition. Fifth is, definitely diagnosis and drugs, the medication aspect of it. It's also connected with the drug manufacturers. Last one, definitely after effects of medication, or you call side effects or whatever, addictions and all those things to the medication. You can see a clear sequence flow in the whole text. This is what you have to understand. As you skim through, you can get these things, and I'll show you as we go on. Now, I am going to look into the text gist or main idea, questions, clues. So a sequence. See, fact about ADHD. 15 questions speaks about writer questions something. He is challenging something. The second one, controversy. I told you, second paragraph speaks about controversy regarding ADHD. And Dr. Saul objects, a particular person objects certain things. So controversy happens when there is an objection. These are the clues from the questions. Okay, ADHD and other conditions. The question 17 speaks about distinguishing ADHD from other conditions. Fourth one is onset or beginning or genesis. 18th and 19th question speaks about studies and adult onset of ADHD. Okay, different various studies on this particular condition. And 19th speaks about adult onset ADHD. Fifth paragraph speaks about diagnosis and drugs, as I told you, medication. And the question 20 speaks about drug companies, drug manufacturers, and they are linked to this particular medical professionals or the medical condition or the way of testing and confirming. Sixth one is after effect of medication. Question 21 speaks about physiological reaction. 22nd day speaks about addiction to ADHD medication. The beauty of that sequence is, see, this is gist. See, first one I said fact about ADHD, childhood disorder versus afflicting adults. So this is a particular paragraph where you have to understand the gist. This is the introduction or the first paragraph. You can see beautifully it is written. You see all these numbers. I told you have to concentrate on these things, adjectives and modal verbs, comparison, more, and also the conjunction. So now to understand the gist here, you see, you have the American Psychiatric Association recognized attention deficit hyperactivity disorder, ADHD, as a childhood disorder in the 1960s. But it wasn't until 1978 that the condition was formally recognized as afflicting adults. So what do you see? I have highlighted childhood disorder, but afflicting adults. So this whole text will speak about ADHD affecting children and adults. So there are controversies going on, whether the onset is at in the childhood, or can they get as adults, can they have this ADHD without having it in the childhood? So the whole paragraph, the first sentence, the topic sentence, or what you can call the thesis statement of the whole text, tells you what is the whole text is about. That's what you have to understand as you read the first paragraph. Once you understand the first paragraph, things are going to be very, very easy. Then you have this fact they are speaking about. In recent years, the USA has seen a 40% rise in diagnosis of ADHD in children. Again, I say in their Telegram discussions, again, I hear that you say 40%. That is wrong. Please correct yourself. You should never, ever use percentage after digits. 40%, 50%, 60%, never percentage. But you can say high percentage, low percentage, better percentage, all those things you can use, but then never, ever use the expression percentage after the digit. So it is 40% and don't say 40%. You say has seen, article should be there. Usually there you have a problem. Majority of you have sent your letters, have seen, you have a difficulty with the articles. You can't say USA has seen 40% rise. It's USA has seen a 40% rise in diagnosis for ADHD in children. It could be that the disorder is becoming more prevalent, or as seems more plausible, doctors are making the diagnosis more frequently. Now, why it is it's a big issue now? They say it could be maybe they are using a modal verb. It could be, not sure. It could be that the disorder is becoming more prevalent, or as seems more plausible. Plausible means believable. Doctors are making the diagnosis more frequently. Now you see, more frequently they are making diagnosis. Maybe in Kerala is an example, they are making more tests, so there is more data about the coronavirus or the corona affected patients. So also here, they say earlier there weren't enough diagnosis made or effective diagnosis made. Today we have effective diagnosis patterns, so that's why we have more number of ADHD patients. The issue is complicated by the lack of any recognized neurological markers for ADHD. Means neurological markers or symptoms are not very clear. So what happens? We have to rely upon subjective symptoms or some hearsay, or it's not very sure what are the symptoms exactly. And they explain, I don't want to go into detail, but only one thing I want to tell you, look at the focus or the thesis statement or the main sentence, which I highlighted with green. That is the mother sentence of this whole text. If you understand that particular sentence, it's going to be very easy to understand the following sentences. So here it says, but with a contrast here, the whole text is going to speak about childhood disorder and adulthood disorder. ADHD affecting children, affecting adults. Now let's go into the question. This is the first question. Can somebody read for me?
First paragraph, the writer questions whether adult ADHD should have been recognized as a disorder at an earlier age. ADHD should be diagnosed in some way for children and adults. This can actually be indicated by neurological markers. Cause of ADHD have genuinely increased in the USA.
Okay. Now, when you read, hold the mic closer and little more powerful next time. See here, first paragraph, the writer, the first paragraph is mentioned. As soon as you start, before you start answering the things, just mark the paragraphs 1, 2, 3, 4, 5, 6, so that immediately you launch into that particular paragraph. You not go on counting so that you waste your time. So first tip is that you have to mark the numbers against the paragraphs. So in the first paragraph, the writer questions, means there is a disagreement. The writer is not agreeing with the thing. He is questioning particular aspect. The answer is cases for ADHD have genuinely increased in the USA. Okay. He questions whether cases of ADHD have genuinely increased in the USA. And we have seen in the paragraph, it has not genuinely increased because they have put more diagnosis now and the system has improved. So it is possible that those are putting into more of diagnosis more frequently so that you have more number. It doesn't mean the ADHD is affecting more people. So the author has an apprehension, he doesn't agree. So he questions the fact whether they agree. Let's see how it works. See, writer questions the whole aspect about ADHD. They say a lot of people are suffering from ADHD now. So is it a fact? So in the first paragraph, the writer questions whether cases of ADHD have genuinely increased in USA. And the first one is adult ADHD should have been recognized as a disorder at an earlier date. They don't speak anything about earlier date. They say, but it wasn't until 1978 that the condition was formally recognized as afflicting adults. They say it was recognized. It is a factual statement, so it is not giving an opinion. So they are trying whether you can understand the difference between fact and opinion language. So here, option A says, adult ADHD should have been recognized as a disorder at an earlier date. But here they say it wasn't until 1978 that the condition was formally recognized as afflicting adults. So this doesn't go there. Means they already say factual statement they have made. By 1978, the condition was formally recognized. So that is eliminated. ADHD should be diagnosed in the same way for children and adults. They don't speak anything about diagnosis of children and adults. They say there is a difference, and it says it specifies that patients under 17 must display, means children must display at least 6 symptoms of inattention and or hyperactivity. Adults need only display 5. So this is contradicting to the statement here. So that can be eliminated. ADHD can actually be indicated by neurological markers. Nothing is mentioned about neurological marker in the whole text. So that's also eliminated. Controversy. Subjective criteria and vague and subjective symptoms all are abnormal. See, this paragraph speaks about subjective symptoms or criteria or the vague subjective symptoms. It's not very sure what are the symptoms of this particular disease. So what the author says, Richard Saul says, he is like you, when you read, when you skim, you should look for names. So the question is here, answer is here with this name. Okay, there is one more name, but then there are two names. So when you look into two names, definitely you'll find one name in the question. Definitely you can go there. See, controversy. See the beginning topic sentence. ADHD can be a controversial condition. There's an argument, controversy. So there are two people arguing. And here you see Dr. Richard Saul, a behavioral neurologist with 5 decades of experience. I have striked out these parts because this is not essential. I told you between whatever happens between the comma can be secondary information, or this is called subject complement, which you can just skip and read so that you can go faster. So you can read this as Dr. Richard Saul disagrees. Immediately you can read this way, striking out these secondary informations. So under such subjective criteria, the entire population could potentially qualify. Could, again, you have modal verb here. Potentially qualify means all are abnormal. If you do the analysis in this way or assessment in this way, particularly probably you will say all are abnormal, all have ADHD disorder. So could be, again, the modal verb is used. And coming to the question, what does Dr. Saul object to? Can somebody read loud? And
What does Dr. Saul subject to? A, the suggestion that people need stimulants to cope with everyday life. B, the implication that everyone has some symptoms of ADHD. C, the grouping of imprecise symptoms into a mental disorder. D, the treatment for ADHD suggested by Dr. Pavli draws attention to the poor care given to such children.
The name you, when you skim, you have to identify the name. So immediately you can launch into this one. Here there is disagrees. There's a word. We'll look into the comparison of question and passage. See, Dr. Saul objects. Here it is disagrees. So the synonym is being used. Objection, disagreement. So name is given here, name is given here. So immediately you can launch into the answer. You know, read the rest of the whole part. Only if you have some doubt at the end, you can skip and go at the end. You come back and scan the whole paragraph or text if you require. But then, as usual, you can just jump looking at this name and identify this name. That's why I said skimming. The clue is name, go into the name, and immediately you understand, and you can strike out all those secondary informations between commas, what you call subject complements, which are not essential to answer. The suggestion that people need stimulants to cope with everyday life. Nothing is mentioned about they need stimulants to cope with everyday life. And he is objecting. What does Dr. Saul object to? The suggestion that people, he is not objecting to that. The implication that everyone has some symptoms of ADHD, he is not objecting to that. What is he objecting to? The grouping of imprecise symptoms into a mental disorder. He is saying, see, here it says, controversial condition, Dr. Russell Barkley, professor of psychiatry at the University of Massachusetts. See, between Russell Barkley, the comma, and this semicolon, you can strike out the things. The science is overwhelming. It's a real disorder which can be managed in many cases by using stimulant medication in combination with other treatments. So Dr. Richard Saul disagrees. Many of us have difficulty with organization of details, a tendency to lose things or to be forgetful or distracted. Under such subjective criteria, the entire population could potentially qualify. Means entire population, you will say, will have ADHD because we once lock the door and we go and again reconfirm or switch off the the gas connection, but again we go and recheck, and you can say that it is ADHD or some other things or compulsive disorder or something of that sort. ADHD cannot be on subjective criteria. So he says all will qualify, all the population could qualify, entire population could potentially qualify. Means he will say that entire population is affected by ADHD. So that is the disagreement he has. The treatment for ADHD suggested by Dr. Barkley draws attention to the poor care given to such children. Here they are speaking not poor care, this is just opposite. Here they are saying, although some patients might need stimulants to function well in daily life, the lumping together of many vague and subjective symptoms could be causing a national phenomenon of misdiagnosis and over prescription of stimulants. So they are not speaking about poor care given to children. They don't speak anything of that sort. Okay, this is just speaking about the symptoms thing. The third paragraph speaks about ADHD and other conditions. This is the third paragraph. Non-specific nature of symptoms of ADHD. Same thing is opinion for assessment. Is the criteria is opinion. They are assessing whether you can understand opinion. See, again, I said children and adults. Children repeated. but it could also prove the non-specific nature of the symptoms of ADHD, anxiety and depression, or an altered state can easily be mistaken for manifestations of ADHD. So you can just read like this. It could also prove the non-specific nature of the symptoms of ADHD, which can easily be mistaken for manifestations of ADHD. So modal verb is being used, whether you understand modal verbs. So non-specific nature of symptoms of ADHD. It's not very specific in children or in adults. That's what the whole paragraph speaks about. See, again, next.
The writer regards the study of children in foster care as significant because it highlights the difficulty of distinguishing ADHD from other conditions, focuses on children known to have complex mental disorders, suggests a link between ADHD and child's upbringing, draws attention to the poor care given to such children.
Yeah, so definitely from this keyword, because they are looking for a reason. So you have to give a reason. The writer regards the study of children in foster care as significant because it highlights the difficulty of distinguishing ADHD from other conditions. So why is giving? We'll look into the text. See, a recent study found children in foster care homes 3 times more likely than others to be diagnosed with ADHD. Researchers also found that children with ADHD in foster care were more likely to have another disorder, such as depression or anxiety. This finding certainly reveals the need for medical and behavioral services for these children, but it could also prove the non-specific nature of the symptoms of ADHD, which those are like anxiety and depression or an altered state, can easily be mistaken for manifestation of ADHD. See, the writer regards the study of children in foster care as significant because why the study of children in foster care is very important because highlights the difficulty of distinguish ADHD from other conditions. You can see here how it is difficult to distinguish between other conditions like anxiety and depression or an altered state. There's a lot of confusion. So this linking sentence clearly speaks about this. Focuses on children known to have complex mental disorders. They don't say the children at foster care have complex mental disorders. Nothing is mentioned in the paragraph. Suggests a link between ADHD and children's upbringing. It doesn't speak anything about children's upbringing. Draws attention to the poor care given to such children. They don't speak anything about the care given to the children. So it's very clearly given. The other 3 options are irrelevant to the paragraph. Is about a question about gist. See, onset or genesis, beginning of ADHD. See, first sentence itself says that is topic sentence. That's what I said. You have to understand the focus on the structure of the sentence. That is, that first sentence gives you the theme or structure or gist of the paragraph. ADHD begins in childhood. Where does the onset happen? Genesis or beginning of this particular disorder. So ADHD, the thinking goes within inverted commas, you can strike out. You need not even read. That's the secondary information which you don't require to get the gist of it. So ADHD begins in childhood is the topic sentence. Then you have adult, childhood, or genesis, that is onset, adulthood, adult onset, childhood, adulthood, adult onset, subthreshold ADHD, which means childhood, youth, kids. See how repeatedly they are speaking about the particular mother sentence I told you in the first introduction, the first sentence. They are repeating the same idea in all the paragraphs using this child, adult, child, adult. So the first part of this paragraph speaks about childhood onset of ADHD, whereas starting, however, with a contrast with another name as a clue for you when you skim, you have, they are speaking about adult onset. So the first part speaks about child onset, second part speaks about adult onset. So if the question is particularly from child onset, you need not come back to this particular area. You can remain here. If it is about adult onset, you can remain here. There are 2 questions, I believe, from this particular paragraph. 18th one. In the 4th paragraph, see again, I said you should number the paragraph so that immediately you jump into 4th paragraph, the word they refer to. These are called referent questions or lexical questions. So what does the word they refer to? Okay, this particular word, they. And beautiful, I think recently somebody has put a beautiful Tina, I believe, in the Facebook. It clearly explains what it is. So here you see, however, studies from the UK and Brazil published in German Psychiatry say this is not relevant between commas, so I have striked it, are fueling questions about the origins and trajectory of ADHD, suggesting not only that it can begin in adulthood, but there may be two distinct syndromes, adult onset ADHD and childhood ADHD. So, however, there is a contrast. It's a clue for you. The answer is here, studies. Okay, from the UK and Brazil. They means refers to studies. They echo earlier research from New Zealand. Means this opinion, these studies give the exact opinion as earlier research from New Zealand. These studies from the UK and Brazil also echo earlier research from New Zealand. So they is the pronoun used or a referent used for studies. And this name leads you to this particular answer. Again, a clue for you to reach the answer immediately. In the fourth paragraph, the word they refers to syndromes, questions, studies, origins. So definitely it is studies, whatever comes prior to that. They, previous sentence, the subject, next pronoun. For example, I say, Tina is working hard to achieve a A grade in OED. She, then the next sentence begins, she persistently practices with consistency every day. So she means Tina. So the first previous sentence subject will be referred with a referent in the next sentence. It's so easy. I tell you, it's a primary school grammar, which you can, and you have in every text, you have two questions of lexical type, which you can easily score. Hope it is clear. If not clear, definitely we are planning of each strategy we will take. Each strategy will have separate sessions. Yeah, please somebody read.
Dr. Farron suggested that the group of patients diagnosed with adult onset ADHD A. had teachers or parents who recognize the symptoms of ADHD. B. should have consulted a doctor at a younger age. C. had mild undiagnosed ADHD in childhood. D. were specially chosen by the researchers.
Yeah, see Dr. Farron. So you have a name here. Immediately you can go to the text to find out the name so that you locate the answer immediately. Suggestion. It's a suggestion, you know. The word suggest says it's a suggestion of Dr. Farron. Let's see. See here. Now, Dr. Stephen Farron. This also tells you whenever you refer first time, even in your writing, wherever, you have to write the full name. Whereas in the question statement, they have said Dr. Farron, the second name. So always first reference will be with the full name, second reference with the surname, second name. So definitely you can, you should not confuse. They think that the Farron is not here. So see, all these things are there. People who had sub-threshold ADHD in their youth. And perhaps you see the hedging word is being used. Okay. And sub-threshold ADHD in their youth. Sub-threshold ADHD in their youth means childhood. Sub-threshold is a childhood. So that's the synonymous language being used. Let's compare. See, Dr. Farron suggests that the group of patients diagnosed with adult onset ADHD had mild undiagnosed ADHD in childhood. Means people who had sub-threshold. Here he says, in Dr. Farron's words, the researchers found a group of people who had sub-threshold ADHD in their youth. Means they had mild undiagnosed ADHD in childhood. The sub-threshold is the synonymous being used for the childhood. There may have been signs that things weren't right, but not enough to go to a doctor. See, here it says, should have consulted a doctor at a younger age. Should, the modal verb is used. They are assessing whether you can understand the modal verbs. So here it says, should have consulted. Here they say it was not necessary. Okay. These were like, there may have been signs that things weren't right, but not enough to go to a doctor. There was no enough signs or symptoms to consult a doctor, but the B option says, should have consulted. No, there was no symptoms to consult. It was not needed at all, but here they say it would have been recommended. Okay, suggestive modal verb is used, should. Had teachers or parents who recognized the symptoms of ADHD. Here, perhaps these were smart kids with particularly supportive parents or teachers who helped them cope with the attention problems. Supportive parents and teachers who help them cope with the attention problems. Such intellectual and social scaffolding would help in early life. So here they are saying teachers, and they did not had teachers or parents who recognized the symptoms of ADHD. They did not recognize, but they helped them out to come out of this attention deficit problems. Okay, and were specially chosen by the researchers. They don't say anything about they were specially chosen by the researchers, these students. They are speaking in general. the student early childhood ADHD. Okay, this is the 5th paragraph. And you can see diagnosis and drugs, drug companies. Again, gist, you have to understand the gist. And until the seldom diagnosed disorder, seldom. You see the scale, seldom means rarely. So often, always. So you see a scale expression there. Seldom diagnosed disorder. That is the topic sentence of the paragraph that speaks about the paragraph. And nowadays, however, it's common in mainstream medicine in the USA, a paradigm shift apparently driven by 2 factors. They are saying now these days, the modern trends are driven by 2 factors. See, I have striked out these things which are not essential. See, many say less stringent diagnostic criteria introduced by the APA in 2019. All these are secondary informations. And marketing by, driven by 2 factors. Rework and marketing by manufacturers of ADHD medications. Some have suggested that suggestion that this new broader definition of ADHD was fueled to broaden the market of medication. Fueled to broaden the market of medication. In many instances, the evidence preferred to expand the definitions came from studies funded in whole or part by the manufacturers. The company people, manufacturers are funding the studies, and clinicians involved in diagnosing ADHD were receiving money from the drug makers or companies, drug companies. So corruption. So you can see how they influence. That's not essential here, but I'm just driving you through the, hope that is clear. And coming to the next question. Yes, somebody.
In the 5th paragraph, it is suggested that drug companies have been overly aggressive in their marketing of ADHD medication, influenced research that led to the reworking of ADHD diagnostic criteria, attempted to change the rules about incentives for doctors who diagnose ADHD, encouraged the APA to rush through changes to the criteria for diagnosing ADHD.
See? Seldom diagnosed until this century, adult ADHD was a seldom diagnosed disorder. Nowadays, however, now there's a contrast coming. Nowadays, however, it's a common in mainstream medicine in the USA, a paradigm shift apparently driven by 2 factors. All those things they are saying, then they are saying how it was fueled to broaden the market for medication. In many instances, the evidence proffered to expand the definitions came from studies funded in whole or part by manufacturers. This all things say the manufacturers who are controlling the diagnosis aspect of ADHD. They fueled or they controlled, they funded partially or wholly the research work or studies on ADHD. And as a criteria, they also clinicians involved in diagnosing ADHD receiving money from drug makers. There are also reports that the corruption was happening. Clinicians were getting money and they were diagnosing many people having ADHD so that the market could be fueled or encouraged. So you'll see this comparison here. Okay, influence research that led to the reworking of ADHD. The synonymous language used for influence is fuel and involved in getting money and funded by the manufacturers. All these are influences, giving funds for studies on ADHD and also bribing them, bribing clinicians and fueling or encouraging the diagnosis of ADHD, all by drug mafia or marketeers is important. So the only this particular thing is true here. First option being overly aggressive in their marketing or ADHD medication. They are not, the whole paragraph doesn't speak about any aggressive marketing strategies of particular drug company. It doesn't speak drug companies, how do they market or their aggressive way of marketing. It doesn't speak anything. It only speaks how they influence the medical professionals. Third option is attempted to change the rules about incentives for doctors who diagnose ADHD. There is nothing about rules about incentives. The whole paragraph doesn't speak anything about rules about incentives for doctors. It speaks only they were bribing clinicians or doctors or health professionals. Fourth one, encourage the APA to rush through changes to the criteria for diagnosing. Nothing is mentioned about they influencing APA. They are speaking about influencing the clinicians or the health professionals. So that also can be eliminated. Now, 6, addictive nature of ADHD. Paragraph speaks about after effects of medication, that is addiction. See the beautiful topic sentence. This brings us to the issue of the addictive nature of ADHD medication. So the whole paragraph speaks about this particular, that was the glance about the text, whole text. That is the best clue for your understanding and identifying the answers. And I'll show you how can it be done. Medication, and at the end, they conclude, say that, so more work needs to be done before we can settle the questions surrounding the diagnosis and treatment of ADHD. More work needs to be done. Means we have to do more. Whatever is done is not sufficient. That's not enough. So what I wanted to show you is here, this sequence, what you call coherence and cohesion in the assessment criteria. In all the tests, you can use that particular approach where you need to understand the sequence. And yeah, next.
In the final paragraph, the word trademark refers to A, physiological reaction, A, substitute medication, C, a need for research, D, a common request.
The trademark, what does it mean? This is because the body stops producing the appropriate levels of neurotransmitters that ADHD drugs replace. A trademark of addictive substances. This is body means physiological, stops producing the appropriate levels of neurotransmitters that ADHD drugs replace. A trademark means this particular aspect is the trademark. Let's check. See, in the final paragraph, the word trademark refers to, you can easily make a physiological reaction. This is because the word body stops producing. What is the physiology? Body means physics. Physiology is synonymous used for body. So this hyphen, a trademark, means this is the trademark. So again, this is a lexical question. That's what I said. You have two lexical questions. Clearly speaking, the answer is just before that particular question. And the last one.
In the final paragraph, what does the writer imply about addiction to ADHD medication? It is unlikely to turn into a problem on the scale of that caused by opioid abuse. Second one, the effects are more marked in certain sectors of the population. Insufficient attention seems to have been paid to it. The reasons for it are not yet fully understood.
Yes. See, at the end of it, actually, it says more work needs to be done before we can settle the questions surrounding the diagnosis and treatment. Let's compare it. Here you can see in the final paragraph, what does the writer imply about addiction to ADHD medication? It is unlikely to turn into a problem on the scale of that caused by opioid abuse. It doesn't speak about opioid abuse at all. The effects are more marked in certain sectors of the population. They don't speak anything about different sectors of population in the whole paragraph. And the reasons for it are not yet fully understood. They are not speaking about reasons are not fully understood, but insufficient attention seems to have been paid to it. So more work needs to be done. That is a paraphrasing of insufficient attention seems to have been paid to it. We have done some work, but you need to do more work. We say you have done some practice, you have been doing practice, but then you need to do more consistent practice to get a good score in OET. So more work needs to be done before we can settle the questions surrounding diagnosis and treatment of ADHD. Insufficient attention seems to have been paid to it. So they are putting in a paraphrased way, insufficient attention is paid, means we need to pay more attention. Here it says more work needs, or more attention needs to be paid, or here it says work needs to be done. So that's a paraphrasing effect being used in this. And once again, with this background, let's go back to the structure of this. See this one, how beautifully it is done. See the test, just main idea, questions, clues. First fact about ADHD, I said in the introduction, the thing about ADHD, children affected by ADHD and adults being affected by ADHD. Writer questions. In the question they say writer questions about this particular fact about ADHD. And controversy, we have seen second paragraph, Dr. Saul objects, and in the passage we saw Saul disagrees. The name and synonym. ADHD and other conditions. Distinguish ADHD from other conditions was the question statement on the right answer option. Onset, here you had question 18, studies, adult onset of ADHD. The studies was a reference question where they had to, the next sentence started with they, which means studies. And diagnosis and drugs was the fifth paragraph. And the question statement was about drug companies. How did they influence the diagnosis and drugs? After effects of medication, question 21 was about physiological reaction. 22nd was addiction to ADHD medication. You know, these things are commonly known. You know, when you speak of side effects or after effects, some drugs do create some sort of addiction in human beings and physiological reactions. Those are the common things when you speak about, once you know the main idea, topic sentence of the paragraph. When you focus on, I said, first sentence, you have the main idea. Then you understand that definitely you have all these answers. Even without reading the paragraph, most of the answers you can find out. For example, the fact about ADHD, the first paragraph, the American Psychiatric Association, their view is given here about childhood disorder and afflicting others. And that is going to be the crux of the whole text. So that you have to understand as we go on to next. ADHD can be a controversial condition, and controversy, it speaks about, this paragraph speaks about controversy, and the question speaks about a controversy, or he disagrees, this particular person, that is being given. So controversy, so it's clearly given there. And opinion about opinion question, ADHD and other conditions. Okay, how there is a confusion between identifying or confirming the things because there are symptoms of other conditions similar to that of ADHD. So ADHD begins in childhood. Next paragraph speaks about ADHD in childhood and genesis, onset. Then the next diagnosis speaks about diagnosis and drugs, seldom diagnosis disorder. Okay, next one speaks about after effects of medication, the issue of the addictive nature of ADHD medication. The topic sentence clearly speaks about it. So I think that's it. Again, I tell you, go with patience and try to understand this particular sequence in the text. That is the best idea. See this sequence, if you identify the sequence just by skimming, means just going into the first sentence or the topic sentence or the main idea or the second sentence. Sometimes, most of the time, as you see, almost 5 paragraphs, you have the first sentence itself as the topic sentence. So definitely you can go into that first topic sentence and you can understand, you have a summary in this sequence, all the main ideas, and all the questions are based on this particular topic sentence or the main idea of the paragraph. That's how you understand this topic. Hope I have made sense. Did I go too fast? And beginners, I have not highlighted all the model verb strategies in this particular session because those are known to majority of the people. If you have any concerns, definitely text in the mentors hour during the mentors hour today. If you have a particular strategy, for example, model verb or something like scale or synonym or synonymous or paraphrasing, if you have any difficulty with that particular one, I'll think of taking one session exclusively for that particular strategy. Okay. Do you need to visit any of the slides?
Yes, Father.
Yes, Father. The
Which
first
one?
few slides.
Yeah.
Yes.
Yeah.
Fourth
Fourth
slide. Hedging words and subjective
Yes,
agreement.
yes. Okay. Subjective read for emotions, hedging words, the previous one. Identify opinions by hedging words. Hedging words means probably. Probably, for example, Mr. CG is inviting me for a dinner. Then somebody else asks me about that particular program. Then I say, probably I might go tomorrow to his residence to have dinner with him. Probably means not sure. Let's say opinion. Right. But I will say, I will be going. I'll be there. If I tell you, I will be there at any cost, I'll be there. There's no probability. Definitely, I'll be there. Perhaps I might attend the function tomorrow. That is opinion statement. Whereas I will be there. I'll be attending tomorrow's function. I'll be attending tomorrow's session, which means factual statement. Definite is. Maybe, likely. It's likely to rain. I'm not sure. It's likely to rain here. You understand that? These expressions tell you these are opinion words. The particular person is giving his opinion. The next
Fourth slide. Yes.
Okay. Read for emotions or subjective agreement. Some of the words are full of emotions. The invitation was really compelling. I could not help but go. Invitation was so compelling, means it was so, I could not escape from that particular interesting, compelling invitation. Or the program was so interesting, I could not come out of the program. I just wanted to sit there 5 minutes and come back from the program. I had some other, but I said it was so interesting. I could not get up from the seat. Or remarkable. The session was remarkable or worthy of attention. Actually, I thought of attending the session just by listening to the session, but I was so involved, so remarkable the session was. I left my duty or left my other works. I did not cook today. I attended the session. Remarkable, worthy of attention. Unfortunately, I was out of the session because of internet issues. Sadly, I was disconnected from the Zoom session due to network issues. Those are the emotions or subjective agreements where we have a lot of emotions put into the word. That shows you are speaking about opinion. You are speaking your opinion or you are expressing your opinion. Is that clear?
Yes, Father.
Yes. Any other slide you want to visit? I've gone a little fast here because majority of you are not new to my sessions. That's why I did not highlight all those things, simple things, but you can identify when you go back. That's why we are not keeping task on these days. I want you to go back. Definitely you have taken the screenshots, or definitely those who have taken the screenshots will share them and go into each and have your comments, do the analysis of each paragraph and try to even write down and highlight. Okay, that will help you. Then if you don't understand something, post in the concerns during the mentors hour, or you can even text me personally. If you post in the public platform, the Empowering Army will help me to compile those things. Whereas if you personally put me, I'll have to spend time on that. However, if you are very uncomfortable for certain valid reasons that you cannot interact in the main platform, definitely you are welcome to DM me or directly message me. DM means directly message to me through my WhatsApp or Telegram. Any other slides you need to revisit?
The second point, could you please show?
Second point is identify opinions by marker words. Marker words means, in my opinion, I think, say, I believe that we are not going to have sessions today again. I believe means, I believe, that's my belief. It may not be true. I believe all the students are really committed to the OET practice. Okay, I believe that's my belief, but it's not, it's subjective. It's not the fact. They say you are all good OET aspirants. They say means opinion. It doesn't mean all are good aspirants. It may not be all OET aspirants good. Or I think you will be definitely scoring A grade in English or in reading. I think that's my opinion, not fact. In my opinion, today it might not rain. Okay, those are the marker words we say to identify the opinions. Is that clear?
Yes, Father. Thank you.
Yes, Father.
Yes, I think I can stop sharing, right?
Can you show fifth slide also? Fifth one.
Look for opinions in the main clause. If you have attended my writing session, step-by-step, writing step-by-step, I taught you what is a main clause and a subclause, where I use the expression independent clause and dependent clause to make it clearer. Here, main clause means independent clause. Subclause means dependent clause. So despite the countless challenges that the OET aspirants face in the low resource environment created by various service providers, is a dependent clause because in itself it has no perfect meaning. OET remains the best hope for many health professionals in building up their future. This is an independent clause, which means without this portion, this gives meaning. OET remains the best hope for many health professionals in building up their future. So I told you when you have to summarize various case notes into one sentence. Previous in my writing step-by-step, I showed you about 8 case notes into one sentence. Okay, so you can make a complex sentence and combine all those things. So what I want to tell you, usually you'll be disguided by this portion of the sentence. It looks long and beginning they give. So does it speak good about OET or bad about OET? Positive about OET or negative about OET? So here it speaks positive. It is the best hope for health professionals. Main clause speaks about the opinion. If somebody is saying an opinion, I am saying an opinion, despite the countless challenges that the OET aspirants face in the low resource environment created by various service providers, OET remains the best hope for many health professionals in building up their future. To understand my opinion, you have to focus on the independent clause. This is the independent clause. Whereas this is dependent clause. This clause starts like despite the challenges, although, even though, all those expressions. So for opinions in the main clause. Look for opinions in the main clause, not in subclause. Subclause speaks negative about OET. The main clause speaks positive about OET. Although Soumya is lazy, she is working hard these days. So am I giving a positive opinion about Soumya or negative opinion?
Positive.
Positive. So, but then if you focus on the first part of my dependent clause, you will say Soumya is lazy, father is very sad about her. Am I sad? No. I'm happy. she is committed and working hard. So that's what I said. Focus on the main clause. That's the beauty of it. Then what happens? You can just skip these parts and go to the main clause, provided you know what is a dependent clause and independent clause, or main clause and sub clause.
Thank you so much, Father.
Thank you,
Father. Thank you, Father. Thank you.
So I have taken a bit advanced session. I don't know how did you feel. You can come out with your opinions or concerns or what is the time. You have 9 more minutes if need be. Today it was a registered session, but the platform was full. We did not give in public platform the link. It was restricted only to the selected people. Yes, anybody wants to express your opinion? Did you understand, or did you find maybe the exam takers? These sessions are flooded, mainly focusing on the exam takers. And others who raised your concern regarding part C. This is from official OET materials. So definitely you can feel it is soft. Now, this is not done. You have to work on this particular text again. Through the slides, you have to go through the slides and work out again and find out why this is the answer, why the other one is not the answer. And in C, part C, you can see majority of the answers are straight and other 3 options has no idea. And you have seen here you have 2 A answers correct, 2 B answers correct, 2 C answers correct, 2 D answers correct. That's what I said in the elimination method. You have 25% option. Okay, exactly. There are 8 questions. 2 A answers are right, 2 B answers options are right, 2 C answers options are right, 2 D answer options are right. Even if you mark all the A's, you will get 2. Means out of 8, 2. If 3 options, you get most out of 9, you will get 3 or 4.
Thank you, Father.
Good morning, Father.
Yeah.
Father, I have doubt.
Yes.
You told this lexical question. So always the answer will be the previous sentence or can be the next sentence.
Yeah, it can be then. Yeah, either previous sentence or next sentence. For example, if the particular word speaks some object complements, normally, as you have seen today, both were previous. Like, no, it was referring to the previous sentence.
Yes,
Sometimes, for example, the service providers who deal with something, they say who. So who refers to what? Who refers to the service providers, but the explanation given will be given in the next question. After who? Say the nurses who take care of COVID patients. So who refers to who? Nurses?
Nurses. Okay.
Okay. So that way it can be, sometimes it can be the explanation can be soon after the. And actually in my previous session, I have given you an example on that and we discussed almost like 15 minutes. Maybe you remember Krishna asked me some doubt and she was challenging me. And after that, what you call lexical question became a sort of cake for her. She never practiced it again because it was absolutely perfect example.
Thank you so much.
Yeah, yes, and definitely we'll be considering because Vinny also has a concern, right? On referral questions, lexical questions. This is the easiest ones, okay? Easiest ones that you can score without any difficulty or without reading the paragraph. Usually they give 2 questions from that particular paragraph. One will be reference or a lexical question and another question in the same paragraph. So this lexical question comes without spending time. You can just read the previous subject of the sentence. That will be used as today I said, they, the earlier studies. Okay, studies was the subject that is referred as they or she, it. Reference will be used. Or else just they will say who or which. Those connective words, the previous thing is referred to. And if you need more explanation after who or which or that, what comes is the explanation for that, confirming that the previous thing is referred to. So you need not read the whole thing. 1 or 2 sentences will be sufficient. That too, if you need confirmation. Otherwise, immediately you can find out when say you said they today, immediately go to the previous subject of the previous sentence. They means who? Studies.
Father.
Yes, Vinny.
Father,
Yeah.
what I do always, I will choose the correct answer. I will get confused with the other option and I will, I don't know why nowadays only the lexical questions are sometimes getting wrong. I will get all the other answers maybe like in out of 8, I will score 6, but my lexical questions will be wrong. Like it or they.
Yeah, maybe soon we'll have a session only for lexical questions. You also send me some examples, some material that will use the same paragraphs and we'll have only for lexical questions so that you are perfectly all right. all the possible strategies and ways to understand that I'll explain. Only lexical questions.
Thank
But
you.
lexical questions means 4 marks for you, free of cost, easy access. 4 marks in 2
Yes,
texts,
yes.
you have 2 each.
Yes, Father. So
So
4
A-
marks I can.
Yeah, in
easily
A
get.
part, if you get 20 in A part and 4, this one is free bucks, 4 lexical questions, 24, then you need only 6. Even if you go marking only any one option, after the breakfast, at the 18th minute, you can decide which I will mark for all the questions which I don't get, A, B, or C, or D. If it's after lunch session, post lunch session, you can think of 13 minutes after the lunch, which are the options I am going to mark. Even with those strategies, non-intelligent guesser, you can go at a B, no issue at all. Because after 24, you need only a 6 or 7.
Yes, Father.
Yeah, that is from 18, you need 6.
Yes.
Yeah, which means it's very easy. One of the easiest competitive exams, easiest competitive exams, because most of the competitive exams have this English doesn't have negative marking. Otherwise, other exams all have negative marking, where you have a lot of challenges. But here, no negative mark. You can definitely score. Only thing I want to wipe out that the whole idea that is created, especially in Kerala, that it is a very challenging, very difficult. Unless you try it 3 times, you won't get. Unless you try it 5 times, you won't get. These are the misguided feelings. First, that has to be wiped out. And you are sure, looking at the whole scenario, you are sure. Because you can, now you see, reading and listening, you need not nobody need to convince you. You know you are improving, right? From the scores.
Yes, Father.
So
Yes,
why should we be worried about it? And definitely even writing and speaking also you can score. And I am trying to introduce one more trainer from this week. And whoever feels comfortable, you can post your corrections in the main group as well, so that many will benefit. That's the best way to, individual training is not required if you follow these methods. Actually, you don't require. For example, now, yesterday, Needu was the first one to respond to my notice to send me the script as well as the audio of the speaking. So suddenly I forwarded it to a concerned person. I'll be introducing soon. And she, I think, script, did I forward you the script? No. So I'll forward. Maybe I thought you should listen. Otherwise, if I give you the script again, you will read into the script. I wanted you to listen to the audio and find out the corrections. That's one of the ways to competency. Even that particular ma'am has corrected your script also. That I'll send you later.
Okay, thank
So
you.
if you can do some 10 speaking, all of you can do the same cue card, then you can look into the corrections. From your speaking, after your speaking, you can look into the corrections. You can find out, okay, where are the mistakes? What are the mistakes, grammar mistakes I make? Okay. Because what you have spoken, you know exactly in your mind. When you listen to the corrected version, you will understand, okay, I used this particular verb here. It could have been used this way. Yes. And thank you, Empowering Army. Because of you, I am keeping so many sessions this week. Otherwise, like even Soumya is getting little relief, I believe. Otherwise, you just imagine all this work was done just by one person, Soumya Shah.
Thank you.
For almost 3-4 months, she was doing it alone. All this work, what you are doing now, the whole army is doing now. Just imagine how challenging it is. Do you suggest? Some are asking for 8 o'clock because they have duty 9 to 5.
Yes, but it's okay, sir, Father, because you have uploaded soon in the YouTube, right?
Okay, I hope so. Now Shalini is helping me. So yesterday she edited Tina's video. So I am supported even more. And she has told me she will edit one more today, Maria's video, probably. Yes. So those helps are very useful because I can save a lot of time, which can be done by anybody. But this training aspect cannot be done by all. Like, for example, even editing can be somebody done by anyone. But somebody cannot substitute training. No? How did you find? Was it very challenging? Today I took little advance. But if you rework on the same text clearly with patience the whole day, definitely I'm sure you will improve in part C.
Theory part is over. Now only practical is remaining.
Yes. Yeah. Who said somewhere it is confusing?
Me.
I didn't get you. CG. Okay. Now that's why I said the confusion will go only when you practice with the same text. So you don't take any other text. Take the same text from the slides you can find out. Otherwise, I can put it forward in the group. Okay. Or you can go to the official site. This is the first sample material from the official site. You can just type in Google OET official materials, first sample test, second text in the three-part second text. First one is about the sleeping disorders. Second one is about ADHD. So you can find immediately. Just type in Google bar. You just type OET official sample materials. Immediately you will find sample material 1, 2, 3 like that. You click sample material 1. In that, see second one. So anybody posting in the group, please acknowledge the copyright. Okay. Say it is from the. Just type this material is from OET official website. That's enough. Somebody can post it, no problem. There with a footnote. This material is from OET official website, so that all need not search. Yeah, please.
This class was very wonderful because before I read all this, so before I have go through this material, but I couldn't understand anything. This was one of the toughest material where we find in the OET material. So today you have explained everything by paragraph, like first paragraph refers to this. The sequence you taught, that is awesome. So we can easily identify the paragraph which is mean by what, like opinion. Right, and that was very nice. I need to go through one more time with this, then I will tell my score further. Thank you so much. The excellent way you taught us today. Thank you, Father.
I knew this is very challenging. That's why I took a sort of abstract text. It is what you call research text. Even in part A, you say it is a research text. There is no headings, no subheadings, how to handle it. You can make in IELTS, this is the strategy. There is a question type called match the headings. They will give you 5, 6 paragraphs. You have to, and then they will give you the headings. You have to match the para with the heading, which means this is the idea. So here also in the reading part A, if at all you get a research text, see that there is a topic sentence that is the heading or the gist or the theme of the paragraph. That's what you have to do first. First, you have to read, skim, go through the paragraph very fast, skim and find out the topic, gist of the paragraph. Normally, it is in the first sentence, most of the time. Then I gave you in the initial, when I took the previous session about reading part B, I gave you the paragraph structure. You remember? Triangle, triangle, upside down.
Father, how to identify the answer.
Yes,
Father.
That is exactly. And I will be here also you can do. For each paragraph, there is a structure. And if you want more clarification, there are 2 videos in my website. Is IELTS videos, Peel, named Peel. If you have not seen, go through that. You can clearly make out. You can peel these paragraphs. That's how you have to practice. Try to peel these paragraphs into topic sentence, supporting sentence, the developing sentence. Then you develop a system whereby easily you understand any paragraph.
One more doubt also, Father. Sorry to interrupt you.
It's okay.
Father, one paragraph we have 2 however, like but, however. Father, in same paragraph, 2 times the however is coming. For example, after the some opinion, the however will come. So we will search answer in the same sentence or the next sentence. So the today's session also we have one paragraph 2 times however. So how we can identify quickly this this is the answer. I was confused.
The focus will be normally on the later part of the second however.
Okay.
Normally it is normally always we don't say 100% because sentences can be structured in different ways. So normally it is the second however, the later post second however, because they are making contrast. And those are the clear clues. Today I did not explain to you those strategies, basic strategies in the paragraph, highlighting those things because you know those things. As soon as you see could, should, and however, but you know, its contrast, is modal verb, all those things you know. That's why I did not explain those things again. And I'll be taking one more session with the same text because I think that is required, where we'll clearly tell you the functions of each sentence, taking maybe 2 or 3 paragraphs in the coming days soon.
Thank you, Father.
Yes, welcome. Yes, Priya. Practice with patience, don't rush. And see that your today's discussions, post your learning so that there are many who could not attend. They will be able to understand something. And when you post the reading and discuss the same reading, you will get a clear idea about it. So one of the I searched for the readings and Soumya sent me also material. I found it is easier, but I wanted to take little challenging for the advanced people. So that's why I selected this one. And actually, I prepared for the first one, sleep disorder, but I found it very easy. Then I skipped and launched into the next one, ADHD. Empowering Army, do you want to get back? Anything you have to discuss? Maybe we can exit and get back for 10 or 15 minutes as normal.
Okay, Father.
Okay, Father. Okay, Father.
Yeah. Exit and immediately you can get in within 10
Okay,
minutes.
Father, we
Same
will
with
come
the
back.
link, yeah. And others, please, those who have time, join the Empowering Army. It's a beautiful life, beautiful thing, which you may not experience otherwise. Okay. People are addicted to it. Now I am trying to make them practice something. Okay. Yes.
Yes, Father. We are
Father.
very happy
Yeah.
in Empowering Army.
Yes, Father.
One by one. One by one.
Very happy. I am very happy in the Empowering Army.
I am also very happy to have being in a part of Empowering Army.
Same here, Father. Very happy. And we will do something. We are doing something and we will do everything. We will practice also.
Thank you,
And
Father.
be impartial when you write your feedback. If you have not understood, tell me you are not understood so that I understand you are a beginner or you need more basic training. Okay. It's like a step-by-step process. And if you reach the final step, then reading becomes a piece of cake. So out of 45, you can just definitely finish within 30 minutes. B and C. We are competent. Yes. So we exit and come back. Okay.
Okay.
Only the Empowering Army. Okay. Thank you so much. God bless you all.
Thank you, Father.
There will be some changes in the
Thank
timings
you,
or
Father.
schedules.
Thank you, Father.
Please note. God bless you all.